Free association is a practice in psychoanalytic therapy whereby a therapist asks a person in therapy to freely share thoughts, words, and anything else that comes to mind. The thoughts need not be coherent, but it may help if they are authentic. Telling people the random thoughts that pass through your mind isn't the best way to make friends. It might obviously be boring, embarrassing, or too revealing to make for good conversation. Yet, those thoughts can be useful in the right situations. In therapy, free association is one way to get to the heart of your problems. Free association in psychology refers to a process of discovering your genuine thoughts, memories, and feelings by freely sharing all the seemingly random thoughts that pass through your mind. Sigmund Freud was the first pioneer of the psychoanalytic technique of free association, and he worked on developing this technique further between 1892 and 1898. This new method became a cornerstone of psychoanalytic therapy, and Freud based this method of free association on the theory of psychic determinism that informed all his work. Freud claimed free association gave people in therapy complete freedom to examine their thoughts. This freedom would come in part from a lack of prompting or intervention by a therapist. Freud proposed the technique helped prevent three common issues in therapy: transference, the process of transferring feelings one has for one person to a different person; projection, the process of projecting one's own qualities onto someone else; and resistance, the practice of blocking out certain feelings or memories. In traditional free association, a person in therapy is encouraged to verbalize or write all thoughts that come to mind. Free association is not a linear thought pattern. Rather, a person might produce an incoherent stream of words. They may also jump randomly from one memory or emotion to another. The idea is that free association reveals associations and connections that might otherwise go uncovered. People in therapy may then reveal repressed memories and emotions. Freud recommended that a listening person can reflect the crowd. He can do that without talking, by letting the talking person listen to himself. Freud had his patients lay on a couch, look at the ceiling, let their minds wander, and say whatever wandered in. That was his method of free association. That is the way the Freudian psychoanalyst avoids transferring his or her own personal biases and opinions into the internal landscape of the patient. It was for such reasons that Freud did not face his patients. He did not want their spontaneous meditations to be altered by his emotional expressions, no matter how slight. He was properly concerned that his own opinions and his own unresolved problems would find themselves uncontrollably reflected in his responses and reactions, conscious and unconscious alike. He was afraid that he would, in such a manner, detrimentally affect the development of his patients. It was for such reasons as well that Freud insisted that psychoanalysts be analyzed themselves. He wanted those who practiced his method to uncover and eliminate some of their own worst blind spots and prejudices so they would not practice corruptly. After listening to his patients' random thoughts, Freud would analyze the information to find the hidden meaning. The goal of psychoanalysis was to find the source of your problem and reveal it to you. Freud's thinking was that once you understand what was causing you to think or behave in ill-adaptive ways, the problem would naturally resolve for you. Freudian free association is fairly uncommon in therapy these days. Even among neo-Freudians, the technique is not often used, but contemporary mental health practitioners might use a modified version of free association. It is usually used only briefly and as a prelude to an active discussion. Also, in other types of therapy, the thoughts may not all be considered significant. They may be viewed as simple mistakes or unimportant details. Some other therapy techniques use the same type of stream of conscious method. Free association writing involves writing down thoughts as they come to you. You may do this in a therapy session or as a homework assignment between sessions. The therapist reads what you've written and then they'll offer you their thoughts, ask you questions about what certain words mean to you, and explain how your thoughts reveal certain things about you. Some therapists may use a different free association technique by giving you more instructions. They might tell you to think of a certain situation and share the thoughts that arise from that suggestion. Free association is central to the process of psychoanalysis and certainly important in psychodynamic therapy as well as other treatment methods. Therapists do still use free association, although the technique has changed to some extent. In modern therapy, the client usually takes a more active role in the process of unraveling the meaning of the apparently unrelated words, phrases, and descriptions. The therapist might also give more instructions and engage with you more than early psychologists like Freud did with his patients or their patients. Because psychotherapy is more readily available, more people are familiar with it and more open to different therapeutic techniques. Free association has also been depicted in everything from books and movies to animated TV series. So, once you begin to engage in the method, it may seem more familiar to you than it was to people in the late 1800s. This familiarity may make you feel more comfortable with it and you may relax more as you're doing it. In Freud's day, free association was only used in psychoanalysis and rarely in any other situation. Now, it's not only used in psychoanalytic therapy, but it's also used in psychodynamic therapy and other forms of therapy as well. Saying what comes to mind is also familiar to anyone who's been involved in a brainstorming session to create something new or work out problems in, for example, a business. Moreover, free association therapy can provide you with many benefits. It helps bring up things you didn't think were important. In free association, you don't discard thoughts even if you think they're irrelevant. Because your therapist hears every thought, they can understand things neither of you might have realized before. While you might not see the significance of something that comes to your mind, the therapist has a broader perspective, having spoken to many other people with similar mental health issues. Furthermore, you may also uncover hidden thoughts. Sometimes we file away painful thoughts so deeply in our unconscious that even we do not realize they are there. If those thoughts are important to us, sometimes all it takes is a free association session to reveal them. When this happens, the knowledge of what you have been hiding from yourself can bring you a sense of relief and closure. And once you know about that thought, you can deal with it consciously and reasonably decide what to do. Free association can also help you express repressed feelings. People tend to repress feelings that are too painful or confusing to deal with at the moment. You may feel numb about something you think should be upsetting you deeply. For example, if a person who has lost a child feels nothing about their loss, it can be vital to their mental health to confront those feelings of grief. During free association, you can tap into your deeper feelings about such issues, experience them in safety, and eventually move on from those feelings. Lastly, coming to the criticism of free association, the main criticism has been that people may overproduce associations. This can be caused by pressure from a therapist. Someone in therapy may struggle to say as many random words and thoughts as possible. Difficulty can occur even if the person is not actually thinking about these topics. Associations may also be random and unrelated to a person's psyche. For example, someone may start by recalling a memory of their mother. They may remember song lyrics are associated with the memory and then begin naming musical artists, for example. This could create the appearance of associations and memories that do not actually exist.